Very good evening, one and all. I'm absolutely delighted to be with you on this Thursday evening with a wonderful webinar topic, and which is really, I'm sure, very rarely covered in any of the medical forums or medical webinars so far, which is health impacts of cyclones and floods. And this was my brainchild. Okay, when in the December first week, the entire east coast of Indian subcontinent got affected with the Michong cyclone. So I was thinking about what is happening, what a vast devastation that has happened in the states like Andhra Pradesh and Orissa and Tamil Nadu particularly. So after looking at, I proposed this webinar concept with Krishna Anna and our founder president. Thank you, Anna, for your immediate approval on this webinar topic, and you have given us an opportunity to discuss today this very rare topic. And the word cyclone has derived from Greek word cyclos, which means coils of snake, which was coined by Mr. Henry almost 3-4 centuries ago. And we do come across a lot of natural disorders like earthquakes, tsunamis, and so on. But we don't hear earthquakes and tsunamis quite often. But month to month, or at least in a year, definitely we do hear a lot of cyclones happening across the globe. Particularly in India, it is not uncommon to see at least 4 or 5 cyclones every year. In various local countries, like they call with different names, like hurricanes in Caribbean and tornadoes in USA, typhoons in China, typhoon in Japan. But essentially, the amount of damage, the devastation that these cyclones that cause on humanity is majority of times is unmeasurable. What is contributing to these cyclones? And when we were kids, we haven't heard about so much about cyclones. Very rarely, maybe in a decade, one severe cyclone used to come. But nowadays, every year, we are facing this noise. So the reason for this is global warming. And when we look at the measurable parameters from 1880 to 1980, so hardly there is very minimal global warming has happened. But rapid industrialization that has happened from 1980 onwards has led to significant global warming, and per decade there is almost 0.07 degrees centigrade rise of temperature is happening. So with this, in the past 40 years, average rise of temperature has rose to 0.18 degrees centigrade per decade. That means almost close to 1 degree as centigrade has increased the global warming. So planet Earth is getting hotter and hotter. In romance, really, hot is very good, but not in global warming. And with this, I have today a wonderful panel spread across from various parts of India. So let me introduce one by one. My very good friend within short time, Dr. Himmat Singh Rathore has become a very close friend with me through CCI. I welcome heartily Dr. Himmat Singh Rathore as a senior pulmonologist from Assam, working with various hospitals and hospitals there in Assam. Welcome, Dr. Himmat. And my another good friend, Dr. Athul Francis, is a board certified he has got a European diploma in respiratory medicine, and is a consultant pulmonologist from Maz Hospital, Kochi. Welcome, Dr. Athul. And coming to Dr. Kartikey, we have one special guest today from New Delhi. Welcome, Dr. Kartikey Yadav, who is working as an assistant professor with Department of Community Medicine and at Hamdard Institute of Medical Sciences and Research, a senior faculty, well-learned consultant pulmonologist. We have Dr. Debajyoti Bhattacharyya ji. Welcome, Debajyoti sir. We are absolutely delighted to have he is from Delhi, New Delhi. We are absolutely delighted, sir, to have you here. And last but not least, Dr. Parikh, a wonderful human being, enthusiastic pulmonologist, and he has got a couple of fellowships. He has got DNB, MD, DNB, and Asia Pacific fellowship as well in intervention pulmonology. Currently working as associate professor at SMCGH Medical College, Gujarat. Welcome, Dr. Him. Without any further delay, I would now request Dr. Kartik and followed by him to present their presentations on various important health aspects and community medicine aspects, one after the other. And I request each one of you who has joined today to take part in this webinar as audience. I request them to shoot your questions on this rare topic so that this topic will be covered in 360 degrees. Over to Dr. Kartikey.
Good evening, everyone. Myself, Dr. Kartikey Yadav, Assistant Professor, Department of Community Medicine, Hamdard Institute of Medical Sciences and Research, New Delhi. I would like to thank CCI for giving this wonderful opportunity and Dr. C. Vijay Kumar for the brilliant introduction. The topic for today we will be cyclone and floods. So I'll be basically dealing about the preparedness and overview of the health impact. So first and foremost, we should know what is a cyclone. So cyclone is basically a large air mass that rotates around a strong center of low atmospheric pressure. In the northern hemisphere, it rotates in the counterclockwise direction, and in the southern hemisphere, it rotates in the clockwise direction. There are different names in different places. Like you would have heard name of hurricane, typhoon, cyclone. So basically they are the same thing, but it depends on where do they originate. So hurricanes are called hurricanes when they originate or develop over the northern Atlantic, northern Pacific, central northern Pacific, and eastern northern Pacific. They are called as cyclones when they form over the South Pacific or the Indian Ocean, and typhoons when they develop in the Northwest Pacific region. So there's a famous saying that it is the people who matter the most, and without the people, we have no disaster. So disaster means any catastrophe, mishap, calamity, or grave occurrence occurring in an area. It can be either man-made or natural. It can be due to accident or any event which result in substantial loss of life or human suffering or damage to and destruction to the property, in a sense that it is beyond the coping capacity of that community, of the affected area, and it warrants a response from the external agencies. So I'd like to talk about two terms related to disaster. One is hazard and one is vulnerability. So disaster is a mix when both the things are present, hazard and vulnerability. Hazard is a process, phenomena, or any human activity that may cause loss of life, injury, or other health impact, property damage, social and economic disruption, or even environmental damage. So anything in the list, as you can see, earthquake, high winds, floods, landslide, volcanic eruption, any war, these are termed as hazard. Another thing is vulnerability. So these are the conditions determined by the physical, social, economic, and environmental factors or processes which increase the susceptibility of an individual, any community, assets, or systems to the impacts of the hazard. So with the list, you can see that poverty, limited access to certain resources, any lack of institution, education, training, the macro forces being in high population expansion, the urbanization, or the unsafe condition like the fragile physical environment in which the buildings and locations, etc., are very dangerous, or in the sense they are not fit or suitable, and any hazard can trigger a massive response. For example, like if we are here and in some Himalayan regions, avalanche happens, will we call it a disaster? Or we will call it only a disaster when there is a loss of life, flora, fauna. If nothing is lost, it is just an event which happened without triggering any response, and the nature will take care of it on its own. So disaster can be natural or man-made. So the cyclone, it's a natural disaster, but over the years, due to global warming and the temperatures are rising, the sea level is rising, and due to this, we have seen in the past few years that the number of disasters which are happening are increasing. Most commonly being like in this year, you all have heard about cyclone Bhattacharyya. In few years back, cyclone Fani. This. So as you can see, this is an Indian map in which the India is surrounded by ocean, by Bay of Bengal, Arabian Sea, and in the southern region, the Indian Ocean. So we have a very long coastline of more than 7,000 kilometers. So we are exposed to the coast from many sides, and it's a huge coastline. And you can see the color-coded demarcation of the areas which are prone to the disaster. You would have seen that the areas surrounding the West Bengal, Odisha, the northern part of the Tamil Nadu and Andhra Pradesh, they are being shown as red color. So they are at very high prone, and especially in Odisha, every year or every alternate year, some cyclone struck, but cyclone Fani was the most caused most damage after the cyclone Odisha, which happened in year 1999. So the data from 2001 to 2019 from both the cyclones from the Bay of Bengal as well as from the Arabian Sea shows that from the Bay of Bengal, there is an increase, an 8% decrease over the years as compared to the data from 82 to 2000, the 18 years data. But from the Arabian Sea, they have increased. But the frequency from the Arabian Sea is less, and Bay of Bengal, as seen in the news as well, it is more. So they often originate on the eastern side of the North Indian Ocean basin and initially moved in the west to northwesterly direction. So they still dominate in terms of cyclone frequency and intensity as compared to the Arabian Sea. So this is basically a conceptual model of the direct and indirect health effect. So you can call it as cyclone, hurricane, or typhoon. The wind force and flooding, it can lead to changes in social and physical biochemical environment, pollutants and contaminants, which might lead to water contamination, air pollution, bioaerosols, and other pollutants, damage to infrastructure in terms of transport, electricity, housing, and healthcare. So all these things will cause stress, and it can lead to health effects. It can be morbidity, mortality, and affect the vulnerable population. So summarizing it only in aspect to health, we can see through the help of a diagram. The natural hazard, which is cyclone, it will cause infrastructure damage, which in turn can affect water, sanitation, hygiene, that is wash, as well as housing. So water, sanitation, hygiene, because we might not have proper or drinking water source purpose. So poor drinking water availability, unavailability of good drinking water, poor hygiene, and poor sanitation. And in housing, because we will be losing, or they might be damaged to their houses. So they may be shifted to temporary shelter homes and area, which overcrowding and their poor shelter, it might lead to certain disease outbreak. So the cyclones wreak significant havoc, leading to catastrophic socio-economic impacts. They are not only direct, but also as in form of property damage, loss of life, loss of livelihoods, impacts on public health, and long-term economic and societal well-being. So any cyclone, they can lead to loss of billions in the form of infrastructure as well as resources. Basically, it's a coastal area, so most of the population thrive on fishing, or anything related to water, most likely. So after cyclone that is impacted, many diseases, waterborne diseases, or these diseases can be increased, and the schools and education institutes are shut. If they are shut for a long time, it can impact on education, or if the building is damaged, and in the long term economic development, because it takes time to repatriate and rehabilitate the area. Now, these can be the health issues. It can be in the form of communicable, mental health issues, or injuries. The communicable disease, most commonly, anything which might lead to acute gastrointestinal diseases, or leptospirosis, or certain things which breed on water, most commonly malaria, this thing. And as the immunization will be withheld or suspended, so there is high chances that unvaccinated population increases and cases of measles can rise. The mental health issues, because there might having loss of any family members, loss of property, loss of livelihood, loss of their home, so they are displaced. So these act as stressor, and they can lead to they can last for many years as well, the post-traumatic stress disorders. The injuries due to this, lacerations, blunt trauma, any puncture wound, and after this so many animals and insects come out, so the animal bite as well as these cases also increases. So we can classify the host factors and environmental factors. The most important host factors being the vulnerable. The vulnerable group means who are more exposed, the sick, pregnant, the disabled or specially abled, or the children not having proper homes, those living in slums. They are, or near the coastline, they are more prone to be affected in case of any disaster. And environmental, the poor, because they are in temporary shelter in which the roof might not be a proper pakka roof, and there is no urban planning or this short in that area. And the mangrove vegetation is considered to be very important with respect to cyclones, and India caters to around 3% of the mangrove population worldwide. So these mangrove act as a soil binders, and they prevent soil erosion as well as prevent the flooding in that area. So there is a timeline of certain health problems and when do they occur. So the waterborne infectious diseases, they start to occur within 3 to 4 days, and the peak at day 5. but they can occur for some time later as well if there is no proper management of the water. Then acute respiratory diseases, because of overcrowding, it is an risk factor. Then up to 4 weeks, the bites, stings from different insects, scorpions, snakes, and other skin lesions or skin diseases can happen. And mental health problems, they can start with the disaster as well, but it can last for many months to years as well. So disaster management can be defined as the organization and management of resources and responsibilities for dealing with all humanitarian aspects of emergencies, in particular preparedness, response, and recovery, in order to lessen the impact of disaster. So we'll see all of them one by one quickly. So first is disaster preparedness. So it is to ensure that appropriate systems, procedures, and resources are in place to provide prompt, effective assistance to disaster victims as soon as it might happen. So how can we be prepared for this? We can develop public education program. We can conduct mock drills with the local, the media, and this, so that people are aware what to do, where to do, and how to cope with the sudden in case disaster happens. Then next is response. The response is the action which are to be taken after the disaster has struck. For in our case, cyclone. So it includes search, rescue, and first aid, field care, then triage, tagging, and then in case of casualties, then identification of dead bodies. So triage is very important in this, and it can provide effective management with the limited resources available. So we rapidly classify the injured on the basis of severity of their diseases and their likelihood of their survival with prompt medical intervention. So in this, the first come and first serve is not followed. The color coding are red, yellow, green, and black or white. So red is immediate resuscitation, yellow is potential life-threatening injuries, and green is walking wounded who can be taken care or treated after some period of time. Then recovery includes repatriation. Those who are displaced will come back to the original phase. Rehabilitation will include the job, vocational, this social rehabilitation, and then the community recovery, the infrastructure recovery, the economic as well as environmental recovery. Then the last one, mitigation. So it involves permanent reduction of risk of a disaster to limit impact on human suffering. So it includes two things, reducing the hazard and reducing the vulnerability. So hazard is protection against threat by removing the cause of threat. And vulnerability is reducing the effect of the threat. So India is also, with respect to cyclone disaster, we have developed certain warning signals in which scientific and technological means are used to predict and communicate the cyclone which are about to happen, so that people can shift to higher areas, can leave the coastal zones, and this. With the help of satellites, radars, and other accurate we can predict. But a thing which is associated with this is we can only predict around 24 to 48 hours or maximum 2 to 3 days beforehand. So we might not be that capable to make a huge change in the 3 days. We can limit the damage, but we cannot prevent the full damage, because the structural and this integrity might not be according to the place. Then the National Cyclone Risk Mitigation Project. So this, after the formation of National Disaster Management Authority in 2005, it was transferred to this, and the project is the main aim of the project was to protect the vulnerable local communities from the impact of the cyclones. Then the Coastal Protection Initiatives launched in 2018-19, and through the coastal regulation of the coastal zone, what all construction can be done, and this so that we can limit the damage to the structures. Then Integrated Coastal Zone Management Project, it aims to improve the livelihood of the coastal communities and conserve the coastal ecosystem. Next, color coding of cyclones. So the color coded like green, yellow, red. So we can color code them, and people will know the intensity of disaster or the cyclones which are about to struck the land. Even after all this, there are many issues related to cyclone and the management in India, because we still focus mainly on management part and less on the preventive aspect, as with other diseases as well. And because the locals are not very educated or this, so they ignore the warnings, because there is loss of livelihood, the loss of the airland, loss of the daily wages. So they ignore and they do not move or they shift till the cyclone starts to hit the land. Then the state disaster management forces are not that capable of handling, and the National Disaster Response Relief Force has to pitch in, which takes some time, and till then the damage is already started to happen. So, and one more thing related to this is the livelihood pattern, as discussed previously. It depends mainly on the fishery or the fishing industry. So there is not much such. So they refuse to leave the seashore till like 2 to 3 days in advance because of loss of income. So this is the National Institute of Disaster Management website, the link, in which there are many courses on disaster risk reduction. You can apply and you can go through them there, and you can take these courses to get a better understanding, so that we are well prepared, or you are well prepared in dealing with the any sort of disaster, leave specific cyclones. So at the end, I would just like to end with this. The Sendai framework, which happened in Japan in 2015, and it is from 2015 to 2030, which was the sign. So to reduce in the disaster risk reduction, to significantly reduce the disaster risk and disaster losses in terms of lives, livelihoods, and health in the environmental, cultural, social, and physical economic assets of people, communities, and business. So there should be substantial reduction in global disaster mortality, reduce the number of affected people globally, reduce direct economic loss in relation to GDP, and reduce the disaster damage. Whereas to increase the number of countries and local disaster with reduction strategies, substantially enhance the international cooperation to developing countries, and increase the availability and access to multi-hazard early warning system, as with there, it's in the developed countries, but not so in the developing countries. Thank you.
Good evening, everyone. So it was very insightful talk by my colleague, Dr. Kartikey Yadav, regarding the disaster management and preparedness. So I'll be at the first, I would like to thank CCI for giving me this wonderful opportunity to talk on very less discussed but very much important topic, how to prepare effectively to handle cyclone and floods in clinical practice. I would also like to thank Dr. Vijay Kumar sir for giving me brilliant introduction of the topic and myself also. So now moving on to the how to prepare effectively. So as we know, global warming and floods and cyclones. So India is responsible for 0.08 degrees Celsius of warming from 1850s through 2021. India is the fifth largest contributor to global warming. And mechanism we all know, increase in temperature causes increase in evaporation, putting more moisture in the atmosphere, which lead to rain flow and snow. So according to Indian Meteorological Department predictions, the temperature in Himalayan region are projected to rise 2.6 degrees Celsius by 2030. So why it is important to prepare preparedness? So if you can see, the floods causes 46% mortality and tropical cyclone causes 26.1% mortality in last 15 years. So this is beautiful study done by Kamaljit et al. From the year 1970 to 2090, a span of 50 years, and they have looked into the mortality rate. These are the maximum mortality numbers. What are the other effects of floods and cyclones? Loss of jobs, properties, flooding of crops, increase in infections, damage to vital infrastructures, disruption in transportation. And it has much more devastating effects on vulnerable groups like pregnant women, children less than 5 years, elderly people, etc. So my colleague has already discussed this, but I want you to remember this, that there are 4 phases of disaster management. One is called mitigation phase, preparedness phase, response phase, and recovery phase. So where our positions lie, where as a clinician, clinical physician, where our position lie in this response phase, I will let you know on the other slides. So for disaster preparedness, as you can see the graph on your left, one should know hazard knowledge, risk and vulnerability assessment that has been already discussed, preparedness plans, management and coordination, provision of supportive resource, community-based disaster preparedness, public education and training, early warning access to information, life and property safety protection. So just to give you hint, this is the snapshot I have taken from the Indian Meteorological Department, Ministry of Earth Science website. So they show everything in a forecast. They show what is the speed of wind, what is the timing of speed. There is deep depression, what is cyclonic storm, what is severe cyclonic storm, what is very severe cyclonic storm, what is the impact over sea, what is the forecast, what is the observed track, what is the forecast track, everything they give. So this is the authenticated site where you can see whether there is alert or not, and you can prepare accordingly. So just to give you a hint how it looks in cyclone alert. So this was landfall in Gujarat of tropical cyclone Taute. The area in red div is 50 kilometers nearby my city Amreli. So you can see they give you landfall category 3, 125 miles per hour near div. They give you timing and date. So the category 3, what they mention, just for your knowledge, it is Saffir-Simpson hurricane wind scale, which actually categorized according to the wind speed from 74 miles per hour to 157 miles per hour, causing the damage extensive, devastating, catastrophic, more catastrophic. So now let's see how the stakeholders involved in it. So I want you to remember this slide because our position as a preparedness lies in this slide only. So who are involved? Indian Meteorological Department, also known as Ministry of Earth and Science, they issue the alert. Then there is state government and United Territory Administration and Health Services, National Disaster Management Authority, State Disaster Management Authority, District Disaster Management Authority, CHC, PHC. So these are involved in a preparedness phase. So I have shown you the disaster phase management slide. There are 4 phases. And these are the sectors which will involve in preparedness phase. So if you are working in a government hospital or a district hospital, then only your role will come in a preparedness phase. If you are just a private practitioner, then your role will come in a response phase. As you can see, private hospital, 108 ambulance, NGOs are involved in a response phase. So for our specialty, how preparedness for respiratory disease should be done. So this can be done at government, CHC, PHC, your clinic, or any district hospital. So they say drugs and consumables should be stored for that should last for at least 2 weeks. There should be enough amount of antibiotics and antivirals, which of course for the viral and bacterial pneumonia, what kind of viral and bacterial pneumonia, I think we can discuss on a panel discussion. We should have enough amount of inhaled bronchodilators, antihistaminics, antipyretics, nebulizer and ventilator should be checked whether they are working or not. Enough amount of hand sanitizer, mask, IC on cough hygiene. So there is much discussion about food hygiene, sleep hygiene. So there is very less discussed topic is cough hygiene that should be discussed through the IC. So what are the preparedness for other disease? So there are other diseases like contusion, laceration, wounds due to damage. So enough amount of dressing material, sutures, tetanus toxoid injection should be available. There will be a lot of bites and stings. So anti-snake venoms, antihistaminic, steroids, prazosin, waterborne disease. For that you should have ample amount of ORS, IV fluid, zinc tablet, chlorine for water disinfection. There will be exacerbation of chronic illness. So you should have an ample amount of anti-diabetic, anti-hypertensive drugs in your lab, BP apparatus, glucose monitoring machines, etc. For vector-borne disease, rapid diagnostic kit for malaria, anti-malarial drug, doxycycline for scrub typhus. For acute mental health problems like adjustment disorder, depression, there should be mild sedative. Psychotherapist has a male role for post-traumatic stress disorder. And in case of outbreak of vaccine preventable disease, the cold chain equipments, generator for maintaining cold chain, routine immunization should be started as early as possible. So by concluding, I would also like to give some points on what we can do on a long-term preparedness. So there will be periodical updates should be taken by a healthcare worker from the cyclone and flood situation. It should go to the higher authority. It should also take account of children of less than 5 years, handicapped people, pregnant women, population of chronic illness, so that these people, when the flood and cyclone comes in the play, manage effectively, because these are the people who will get more hamper, more devastating effects. Long-term shelter buildings should be made which have emergency care facility available. So such buildings should be available and that should be identified where you can give long-term care and emergency care facility should be there. So nearby district hospital or any big hospital should be identified as cyclone and flood referral hospital. So that can be any hospital that can be marked as a cyclone and flood referral hospital. It should have a primary and a secondary medical team. It should provide all post-cyclone delivery care. And there should be some NGOs are there which we can notify for managing flood and cyclone disaster care. Thank you, CCI team.
What a brilliant talks by Dr. Himmat Kartikey. Absolutely, it's really great amount of knowledge. So I'm sure this webinar would become in future a reference webinar for across the globe. Pulmonologists, general practitioners, any healthcare professionals can be used as a reference point in future. So there are a good number of appreciations that have showered for both him and Kartikey, congratulating both him and Kartikey and appreciating CCI for doing such a rare topic. Let me ask to the panel. Here is a question from Dr. Jayaraman, very good friend of mine and CCA member. He is asking, in Chennai, we had a Michong cyclone effect. Water stagnation, power cut, network issue, and we had outbreaks like waterborne and airborne diseases. Government of Telangana and IMA, we did flood relief camp in many places in Chennai. So, absolutely brilliant work, Dr. Jayaraman. I'm sure you are a leader. So when there is a catastrophe, you we have seen you for the past, our association is more than 1.5 decade. We have seen you come front, and then you have worked very hard during COVID times as well. Really appreciate for the brilliant work. And over to Dr. Bhattacharyya ji for quick comments on this. So, what a basic physician or doctor should do during such times? You looks like you are muted, Bhattacharya ji.
Am I audible, sir?
Yes, you are loud and clear.
Thank you, sir, and thanks to CCI for giving me the opportunity to be this panelist in this particular, though uncommon but very, very important topic, as we see. So I, being from an army background, so though directly I have not been involved in the cyclone or flood relief, but we have multiple times done practice for disaster preparedness. We used to have once in 3 months a disaster management meeting, and there we used to do a real life drill for how to how to go about this flood relief and cyclone relief, and how to do the mitigations, and as a healthcare workers, how we go and work in those situations. Thank you, sir.
Wonderful, sir. But you have drawn a very, very important point here about a mock drills.
Yes.
So can you please highlight something on mock drills, which you have had experience about how to involve in mock drills, how to conduct a mock drills, very briefly, in your experience?
Yes, actually, you know that national this disaster management program which has come during the period of last 1 decade or so, but army has been doing it for many decades. Like when I joined in 1984, since then many a times we have done mock drill. As I said, that around every 3 months we do it. It is not specifically for flood or flood cyclone, but we do it for any kind of a disaster, be it outbreak, be it the earthquake, or be it some railway accident, or some epidemiological disease, food poisoning and all. So in that scenario, what we are supposed to do? First, we have a quick reaction team that contains both the doctors as well as the nurses. In army we call them nursing assistants, and we have the drivers, the ambulance drivers, and the ambulance drivers are taught in such a way, like in Delhi now we have got the CAT, where the driver themselves can do the CPR. They can even, in some the best ones, they can do the cardiopulmonary resuscitation. Along with that, they can do the intubations. Then we have some mock patients. Say, depending on the situation, we have 5 or 10 mock patients. They are from our healthcare workers and we give the situation that they have got fracture somewhere, this person have got some pneumonia or different kind of things. And then mockly we write a prescription, but the doctor and the nurses and the other people, they carry out the things. And then we are given the situation, say that there are around 24 casualties. Out of that, we categorize them as category 1, 2, 3, and the severe ones obviously are the category 1 and 2 and 3. So category 1, but you can wait, but 2, those who are serious, how you are going to evacuate, to those kind of things, and our commanding officer then come and inquires everybody how you do about it. Actually, I can go on and on, but for paucity of time, I think I'll request you to.
I totally understand the amount of knowledge and in-person experience that you have, having come from armed forces. Absolutely brilliant, sir.
Thank you, sir. Thank you.
I want to summarize here is, if you are writing an exam, you have to prepare thoroughly. You have to face the exam. It is the same subject that will be there, but the question paper determines how you are going to face the exam. So sometimes there may be easy questions, sometimes there may be difficult questions, sometimes there may be MCQs, but it is your responsibility to prepare for the particular pattern of exam. That's why it is the mock drills are similar to the mock exams, mock tests that we do in our practice before giving the final test. It is very, very important. The preparedness for this cyclone or the upcoming disaster, how we are going to face it. Everything, the minute selection of categorizing the patient, triaging the patient to, and then doing the surgical operation, reserving the medicines, reserving the blood which might be needed, reserving the forces and relocating the forces from sometimes from army, sometimes from navy, sometimes from different part of the states. I'm sure you all know there is a whole variety of NGOs across India who come the moment disaster is going to happen is announced. They're all ready. They come forward. They volunteer to work for during the disaster times, particularly cyclones and floods. Absolutely brilliant, sir. So coming to my next question to Dr. Him. So you have touched on the personal experience that you have had regarding the cyclone that you have experienced. Can you please elaborate and how your involvement has helped in mitigating the after effects?
Yes, sir. Thank you so much for asking me this question, sir. Actually, I have shown one slide of Cyclone Taute, the landfall, which is in my district and just 40 kilometers away from my city. So the biggest hurdle first we faced was time of COVID-19 because it was around 2021 May. So the COVID work was disturbed a lot. First, another terrible thing happened was loss of electricity, sir. So loss of electricity causes at my home there was no electricity, so the district hospital was well backed with the generators and inverters, so the people were safe. But at the secondary care center, primary care center, at village and taluka level, lot of secondary care centers have collapsed, damaged, so there was a lot of disruption. And first for few 5 days there was no patient, single patient coming to our hospital because loss of transportation. There was many tree falls were there, many houses were fall. Then suddenly after 4 or 5 days, there was rush of many patients, like minor injury patient, major injuries patient. There is patient from pneumonia. There are patient who got just panic that they want to stay at their village or taluka level. They just want to be, indoor at our district hospital because it is safe than their village hospital or their taluka hospital. So suddenly we were also not prepared for such kind of things. So I think it is a teamwork first. Second, you have to counsel and reassure every patient that we are here for more emergency, but you can relocate at your place if there is any minor injury or just mental trauma. So for mitigation, we did 2 schools and 1 college we identify as a shelter house, some sort of shelter hospital also. So where we allowed this patient to go there, remain there in their bed, even in their benches and chairs that has been provided by them. And we also take help of our BHMS and BMS colleagues, and we also take even our help of interns also for just measuring vitals and go there and just counsel them. So it was very mentally challenging for me as a doctor and as a person, as at my home there is no electricity for 5 days, and I have also suffered from a lot of grocery, not a single thing, not milk available for 4 or 5 days. So it was really challenging both as a layman for me and as for doctor for me.
Totally agree, Kim, that during that intense second wave and facing this challenge is, and I'm sure you also agree, when there is such a conglomeration of patients that happen at one building, one COVID case would have spread to all others. So
yes, sir.
Thank you. Thanks for your inputs there. May I request Dr. Himmat Singh, my dear brother. Okay. Can you please elaborate on the common chest problems, our chest diseases that we come across during cyclone, and what measures that we can take to overcome these problems, particularly during a disaster time?
Thank you, Vijay sir, and thank you, Krishna sir, and thank you, Atida, for inviting me as a panelist in the CCI forum. And it is very delightful to discuss on this topic because it is a very untouched topic, and especially being a chest physician, it is our honor to serve during the cyclone, during the COVID, during the disaster period. So, before discussing the chest disease, first I would like to discuss some factors which hamper in the chest problems. Because during the cyclone, there are major sudden temperature change, along with the air pressure change. Then there will be a sudden outflow of the high wind. So it will cause the increased dispersion of the bacteria, allergens, molds. And later on, our government will cut down the power. Then there will be the network outrage. After the cyclone, there will be a complete transporters failure. After cyclone, there will be the overcrowding because of in the rescue camps. Later on, during the restoration process, there will again there will be the mold exposure. So this during the cyclone, usually the pre-existing diseases like bronchial asthma, bronchitis, pneumonia, these will be outburst. And new diseases like the common viral flu, then the patient will miss the chemo dates, and the hypersensitive pneumonitis, some toxic pneumonitis also experienced, and some cases of the carbon monoxide poisoning they are also encountered. So how to overcome? So I already discussed the factors. So if we encounter the factors, we counteract the factors, we will we will better mitigate the disease. Like first, we should follow the COVID protocols. COVID teaches us that stay inside. So during the cyclone, we should stay inside. Then maintain the hygiene. So we will protect from the common viral flu. Then use the mask, because if the one person we will infected, then we have to stay in the closed rooms, so other person may infected. Then most of the studies have been shown that most of the mortalities are documented in the patient of older age group who are on the basic supports, like they are on the nebulization, or the on the BiPAP, or on the oxygen concentrators. So we have to prepare for them, that we should arrange some portable chargeable mesh nebulizer for them. And if possible, then either we use inverters, or for better we can use the generators power. Then keep the adequate medications for the pre-existing disease. We should not wait that COVID cyclone will resolve, then we will come. Always keep at least 15-20 days medication at least. And basic thing, we should keep adequate fuel in our vehicles, because transportation will be completely closed during the cyclone and after flooding. So keep the fuel in your vehicle. This is for the common sense. And maintain the hygiene during the restoration, because after cyclone we have to restore our houses. So there will be outburst of the molds and allergens. So we have to stay inside, keep the mask, follow the good hygiene, and especially protect our children's and older people. Up to you, sir. Vijay, sir.
Yeah. Himmat bhai, okay, absolutely. Okay, thanks for that inputs. So what is, in nutshell, what Dr. Himmat is saying is, whenever particularly you are suffering from pre-existing lung diseases like bronchial asthma or allergic bronchitis, or some other issues like tuberculosis, post-tubercular cavities, bronchiectasis, on all these ILD patients. See, as soon as nowadays we have early warning systems. So as soon as if you are living at the high risk geographical areas, please make sure that you have the adequate amount of medicines available, and you need to maintain good quality diet for next at least 2 weeks. You should prepare for that. You should keep food material in reserve well in advance, and then you should able to buy all acute emergency medicines. Particularly if you know that there is a cyclone is going to hit, you please consult. Nowadays, digital consultation, telemedicine has become almost norm in all parts of India. So you consult your specialist and then get the buffer medications and then keep it with you, so that if in case the power failure occurs, if in case there is a shutdown happens, you cannot move out of your home to get the medications. These medications in reserve will help you and will save you from having a catastrophe. And mind you, all these pre-existing diseases patients and also elderly people and very young children are prone to have huge morbidity and mortality during cyclone recovery phase. And coming to, thank you, Dr. Himmat. Coming to Debajyoti, sir. Sir, yes, Himmat Bhai has covered very decently. I would like to you to elaborate on what are there will be definitely a problem of overcrowding during these cyclones, during these refuges will be put under one roof, and what are the various respiratory illness that can cross-contaminate that can spread across these patients. And there is one particular question from one of our audience saying that, okay, is there any possibility of spreading bird flu or avian influenza during such a scenario?
Thank you, Dr. Vijay sir, for interesting question. Actually, yes, as the previous speakers has very nicely elaborated that in case of any disaster, particularly when there is a cyclone or when there's a flood, so the people who are affected, they will be obviously going to the areas which are not under flood or not cyclone affected. So because of that and because of the shortage of accommodation, so there will be definitely overcrowding. And another important thing during these disasters, particularly flood and cyclone, is that the livestock, the cows, goats, and the other livestock, they also, those who are surviving, they are taken by the owners with them, or the stray animals, they also come. And because there's a shortage of space, so there will be animals also staying with the people. And the livestock include, of course, the chicken and other birds also, the pet birds and all those things. Now, what happens is the pigs, the pets, and all of them are staying together. So the zoonotic diseases, maybe because the cows are there, so there might be bovine tuberculosis amongst the people. Then, of course, snake bites and other things have already been discussed by the previous speakers. And now coming to the interesting thing about the avian influenza, yes, when I was reading through the articles, so I found there is references of this avian influenza amongst flood-affected or cyclone-affected people in some studies in the United States. What happens is this avian influenza, as we know, it is common among the birds, the aquatic birds, the wild aquatic birds. They harbor this influenza A virus, and usually doesn't occur in human beings. But from this avian or the birds, the wild birds, it can be transmitted to the poultry, which are kept by the owners there. And from them, it can infect the human being or the pigs or the cows, and other things also can get it. So there is a definite possibility, and particularly as we are just coming out of COVID pandemic since last 3 years, and unfortunately again the Kerala some new strains are coming. We already got today I got one this thing signed by the Health Secretary, Indian Health Secretary, that we should be careful and we'll take all appropriate COVID precautions, including having all the beds dedicated and all those things. So we should be prepared for having this kind of a offbeat, some avian influenza again, some outbreak. And we all are learned now. We have passed through the first wave and second wave. What Dr. Parikh was telling about his personal the involvement in this during COVID period, the floods what he had. So we all should be careful about this particular thing. Thank you, sir, again for the nice question.
Thank you, sir. And I'm sure Athul Francis is eager to respond. Just 2 minutes. I'll be back to you, Athul. Meanwhile, I have a question particularly praising Kartikeya. So someone is saying that he has done very well. The talk was excellent on cyclone preparedness and mitigation. And the question to him is, are there different types of floods available? And what's the difference between rapid rise flood versus a slow rise flood?
Thank you, sir, for the comment. And thank you for asking me this question. As we have just got to know, we have more than 1,000 live logins. I just like to congratulate Team CCI and Team CIPLA for this achievement. And because I think we have people from all the part of the country, eastern coast, western coast, and southern coast. So they must have experienced different type of this, some due to some cyclones, some due to torrential rainfalls, or some due to overflooding. So there are basically three common flood types: fluvial floods, which are also known as river-based floods, fluvial or flash floods, and the coastal floods. So first one is the fluvial floods or the river floods. As the name suggests, when the water level in any river, any stream rises and it overflows to the neighboring land and this thing. So recently, 6 months back, experienced here in New Delhi, when the Yamuna was overflowing, and it reminded everyone of the past 200 or 300 years when the Yamuna river used to flow next to the fort. And similar scenes were happening here, which though the damage from this, the loss of life was very less, only few incidents, few casualties happened because people were not able to take the hold of the depth, but it caused widespread damage to the properties and this. So usually river floods and this, they can cause damage to the properties and infrastructure, and subsequently the diseases which happens afterwards. Then the other one, the pluvial floods, it can be either flash floods or the surface water floods. So the flash floods, as the name is more commonly seen in Uttarakhand or in the hilly regions, when there is sudden cloudburst or a torrential rainfall, and within 6 hours or within a very short period of time, huge amount of water comes rushing down. And the problem with flash floods is it carries the debris along the way. So you would have seen video of just few months back, near the Manali highway was swept off by the water body. So that can cause a huge loss to life as well as everything which comes in their way. And then other one is the surface water flood. It is basically when the urban drainage system, which commonly are there in all the cities, it's not able to take care of the increased rains which has happened. So usually we do all the municipal corporation before the rainy season of this, they do desilting and all, but sometimes because of increased plastic menace and this, the drainage and everything is clogged. So after the rains, the water rises, but it rarely rises for more than half a meter or 1 meter. So it doesn't cause immediate threat, but as water is there, it will cause damage to everything, like the properties, the vehicles, and those which are there in the basements. So the last one, the coastal form of the coastal flood, in which the coastal region, because of the storm surge, the seawater comes and it goes beyond the normal ashore side. So usually it is seen in tsunamis or in the storms, in which because of high velocity winds, the construction material, usually there are not very pakka houses, the kacha houses, in which they are having tin shades and this, so which get uprooted and the kacha houses get flooded. So the other question which you asked, the rapid rise and slow rise. So as the name suggests, when it is in case of flash floods or this, we do not get any time, and suddenly the water is there and there is very less amount of time to respond. But in slow rise, usually in the cities or this, where we get time so that we can take our stuff or the people to a higher region or on the first floor or second floor and we have to wait till the water recedes.
Thank you, Kartikey. And I'll come back to you again soon. Okay, on what are the various things that fishermen community would be facing during such critical situations, Okay. Meanwhile, let me go to Dr. Athul Francis. First of all, my apology for not involving so far. Okay. Sorry for that, for keeping you wait. Atul Bhai, okay. Our entire colleagues, they have absolutely, said very keenly on various physical aspects of what trauma that our patients undergo, what preparedness with which. But what are the psychological things that we need to focus during a flood event? Yes, please cover from both from patient's aspect and to how mentally we should be strong enough to face being a physician frontline warriors during such events. Over to you, Dr. Atul.
Yes, thanks for the question, sir. I don't have I don't have a personal distinct experience of cyclone as such, but I do have an experience of flood, which happened in Kerala in 2018 as well as in 2019. So more than the health aspect of it, there was a lot to do with the psychological aspect, as you told. So this can be like broadly divided into something which it's happens immediately and something which happens in few weeks to few months. So immediately, as we all know, whenever there's a flood or cyclone that happens, there's a panic which sets in. So this starts right from your household because the water is entering into your house and you have to go for cover or go for protection, either shift to the upper floors or anything of that sort. And on top of that, there is always an inside this thing, like there's an inside dilemma as to almost all the things which are there in your houses get damaged. And when it's related to flood, we always know it starts from the lower part and goes to the upper part. And when you look at most of the household, majority of the what do you call the precious items or the things are mostly in your ground floor, your TV, your sofa, or whatever. So that immediate impact or that panic which sets in is something which is always there. So that and when you take people who are already suffering from some sort of a mental illness like depression or suicidal tendencies or schizophrenia, all these can be a stressor. So this in turn can create more panic inside them. And secondly, what I would like to focus on the psychosocial impact is something which happens on the long run. Because whenever a flood or a cyclone strikes an area, for the next few weeks or few days or few weeks, there will be difficulty in going to work, and especially this mostly affects people who are daily wage laborers because that is how their houses run. And many a times there is lack of availability of basic resources, basic livestock. Your what you sell is your roti, kapda, and makan. So there's a lot of effect which happens there. And many a times you are being shifted to other base camps or to a rescue camp. So many a times many people are not comfortable there also because it gets into crowding, and especially when with children and women around, especially with women who are breastfeeding with small children, it's very difficult, and the psychosocial impact that happens on the head of the family as well as other members of the family is something which we have to look into. And on the long run, there are many people who lose their livelihood, who lose their shops or their basic means of earning, which are destroyed by cyclones or floods, and they don't know where to start. So the PTSD, the post-traumatic stress disorder, is something which is very commonly seen. It's very commonly seen post-flood or post-cyclone, especially for people, and as you told, even the fishermen community. Many of them suffer a lot of problems due to such floods. And now coming to our part, the healthcare or the healthcare workers part of it. The first thing to is we can also be equally affected by all these things. It's not like only a certain section of the society which is affected. And when you are in a hospital, when there's a mass casualty or a mass number of people coming towards you, the right from the triage is difficult because every person will be vying for attention, and no matter how you say you can uh, differentiate into red, yellow, and green, I don't think it will be necessarily possible at that point in time when there is a large amount of people that are coming to you. And secondly, if you have a shortage of medical supplies, that in turn will add to your woes because whom to treat at what, whom to be prioritized at first. And thirdly, the mental aspect of all that. And after COVID pandemic, we all know how much of mental trauma that can be there whenever there's a pandemic or whenever there are there is a lot of patients that are coming to you, especially when you lack the resources that are needed to treat those patients. Like if there are a lot of patients who come with a drowning injury or a exacerbation of asthma, COPD, viral infection, or a viral flu, if you don't have enough oxygen cylinders, if you don't have enough of what is ventilators or other basic amenities, that in turn is adding to your pressure, because at that point in time there are no it's always a contact between the doctor and the patient. The patient initially sees the doctor, so we are always at the front line. No matter what you say, you can't tell them that the facilities has to be provided by someone else, because at that point in time people are in such a mental state that they won't be able to understand your explanation, and you can't expect them to also, because the situation is that. So basically, when you're in a nutshell, if you say, the psychosocial problems are something which starts from the basic things of whatever is going to happen in the immediate future, as well as the rehabilitation or the relocation what the patients have to go through. And ours is more of mental aspect, how to deal with the wide load of patients that are going to come to us in such a situation.
Thank you. Thank you, Athul. Okay. And here comes the next question too. There is one study which was published from France, which shows that in one of the cyclone, 45,000 homes were affected and damaged. More than 1,100 vehicles were damaged, but civilian loss were only 9. I'm sure in such scenario, France government would have handled very meticulously. What are the various immediate measures to be implemented to mitigate mortality? And this question is to our special guest Kartikeya.
Yes, thank you for asking this question. As you have made a comment about France, so we can take certain lessons from such incidences. Like in developed countries, in India, the most important thing which increases the casualties in any disaster is the population size as well as the population density. Our Indian, the population of some states are more than the country itself. If you compare the population number wise of some states, it might be above the population of many countries. So in such an event, and where the livelihood of people living in these regions are basically fishing and the marine industry only. So as Dr. Parikh showed an image in which he has shown cyclone warning 3 issued by the government. So government, because of technological advancements, have set certain early warning alert systems which tell the people that the cyclone is about to fall or struck. But the people are very reluctant in moving away from the coastal region. So, and they just move away when it is just about to happen, or when the army or the defense forces or those who are engaged in the protecting are involved, and they are trying to protect the save the people's life. So in this in our because of the daily livelihood of the fishermen and this, so they just move on the last day itself. That's why we are not able to limit the damage caused by the cyclones.
Yeah, thank you. And to Debajyoti sir, there were also reports saying that volunteers who have been to rescue the affected people were also faced with dangerous situations. Sometimes they lost life as well. Can you please comment on those and what measures that they shall implement to be successful in their jobs they do? Please unmute yourself, sir.
Thank you, sir, for the very nice and important question. So, as we discussed earlier, that you also nicely elaborated on that. Before you appear for an exam, so you must prepare yourself very well, so that actually you should do a lot of mock tests and all, so that when the actual exam comes, you do not have much of a problem. So similar way, when the healthcare workers are going to the field area, means flood affected area or to the cyclone affected area, to look after the patients, both from the preventive point of view as well as from the curative point of view and from the evacuation point of view. So they should keep themselves prepared with what all problems they could face over there, which include both the mortality as well as morbidity, and accordingly they should act. So when there is a flood or cyclone, so the immediate dangers are there, and some of the people will be like, as we have earlier discussed, there will be some people who are the NGOs. Among the affected people or people from immediate surrounding areas, there will be NGOs and other people, or even the military and other paramilitary forces who immediately rush over there. So they might be, the event has not been over as yet. Like cyclone can continue, or flood can continue, as Dr. Kartikey was telling, like being from Delhi, we saw the Jamuna River floodplains increasing and increasing, and those nearby, they are affected. So as a healthcare worker, when I go to these areas, so I may also die if I have not taken proper precautions. So that part should be clear in my mind. Second thing, as we discussed earlier, there are zoonoses, and there are the snake bites and other things also could be there. So we'll have to take those precautions as well. And we should then, another problem when you are going over there is that the potable water is not regularly available. Drinking water will not be available properly. So there is chances of this waterborne diseases. There might be severe infection like shigellosis or salmonellosis. So ideally, like in army, we used to be trained that you carry chlorine along with you, carry some minimal amount of food or dry food with you, so that you can survive yourself for some period of time. And as one of the speakers very nicely said, that you should put petrol properly in your vehicle. And in army also, we used to carry in storage. We used to store our this thing. We used to say the diesel. Usually the army, earlier days when I used to be in the field areas decades back, that time we used to be carrying the diesel. Now maybe the petrol vehicles are also going. So we should carry our fuel, then we should carry our dry food. That's very important. In army, for 7 days or 10 days, the food we used to carry, and that is important. And another important thing is the proper vaccination should be done. Like healthcare workers who are not vaccinated well, like there is a possibility of hepatitis A over there, then hepatitis E over there. I don't think hepatitis E vaccine is available, but A vaccine is definitely available. Then we are just sometime back we were talking about the avian influenza. So those of us, actually, as per the Government of India guidelines, all healthcare workers, whether they have any disease or not, they should be taking the influenza vaccine. So those of us who have not taken the vaccine, we must take the vaccines before we go over there, or rather every year, either as per the recommendation, either just before the winter or just before the rainy season, as per the recommendations of the area where we are staying. CCI had a very nice discussion on this topic, so I'm not going into the details of that. But we must ensure that we all are vaccinated properly. And of course, if there is some severe, like during the COVID time, or during some serious other infection in future, that time even we should carry our proper PPE kits also along with that.
Wonderful summary, sir. Just to summarize quickly for audience, preparedness very important. Make sure, okay, there is a what are air hostesses preach every time we board a flight is, before you want to protect the adjacent person, you please wear oxygen when there is a disaster situation is happening. So similarly, so being healthcare professionals, it is very, very important. We have to stay alert, and then we have to protect ourselves, and then protect the humanity as well. That's a huge responsibility. Onus lies on us. So very simplified, to simplify this, clear food supply, clear water supply, and then regular measures to protect your health has to be followed. in such scenario when you are going as a frontline worker and warrior. And quickly, since Debajyoti Bhai has brought in the vaccinations importance, I will just go through what are the various adult vaccinations that are important. COVID vaccination, influenza vaccination, and respiratory syncytial virus vaccination, which is not yet available. I'm sure it is available. It will be available in short while, probably 6 months from now. It will be available. If you have not done the DPT vaccine, tetanus, diphtheria, and pertussis, make sure you have got vaccinated for that. MMR, measles, mumps, rubella is a mandatory vaccine, and varicella vaccine mandatory. Zoster recombinant vaccine, what is Shingrix, which is available for the past 6 months in India. If you have not done, if you are immunocompromised, if you are more than 50 years age, make sure you take this vaccine. Human papilloma virus vaccine, it is again very, very important to get yourself vaccinated. Please remember, the HPV vaccine is not only for women, it is for males as well. Pneumococcal vaccine, hepatitis A, hepatitis B, meningococcal vaccines, Haemophilus influenza vaccines, and these are the various vaccines that we must get ourselves vaccinated as a frontline warriors. And coming to, there is a small puzzle kind of thing here. One of our life member, Dr. Ravi Doshi, has posted here. I will just read it out. The puzzle is, there is a village that is completely isolated with floods all around the village, and military has started rescuing the villages. Ideally, as per their demography and as per their epidemiological statistics, there are only 500 people, adults live in this village. So army people, they have roped in the helicopters, and then they were shifting these people to a safe place. So what has happened is, after 500, 600 have come, 700 also have come. So how is this happening? Dr. Ravi wants to unpuzzle this. Any comments? When they are evacuating, instead of 500, they are evacuating 700. Don't be so serious. What is happening is, these village people, they are very, very fond of traveling in the helicopter. What they are doing, as soon as they are relocated to safe zones, they are again started swimming and reaching the villages so as to go for the second round in the helicopter. So my dear friends, such a kind of persons will also exist, but don't behave so foolish during disaster times, because the resources are very limited during such times. We have to make use of resource very properly. And coming to the next question, to Parikh Bhai, can you please comment on illnesses for flood-induced contamination of water supply?
Okay, sir. Thank you so much for the pertinent question. Sir, there are water contamination disease are basically two parts. There are direct diseases and there are indirect diseases. So I will frame it in a timeline sort of. So first 7 days, because I have experience, first 7 days, there will be more cases of typhoid, more cases of cholera, diarrhea, dysentery. Then the period comes up from of the rodents. After 1 or 2 weeks, they start coming out, and then there will be outbreak of rodent-borne disease. Like such outbreak happened in Australia, the leptospirosis outbreak, which is again a rodent-borne disease. Urine and feces from the rodent, the bacteria goes to the contaminated skin of a human, eyes or nose, and causing the leptospirosis. We all know conjunctivitis, hepatitis, pulmonary fatal hemorrhage also. There is in 1997, there is one study in Kenya where there was occurrence of a Rift Valley disease, also a very rodent-borne disease, same viral hemorrhagic fever. So these 2 to 4 weeks post-flood, there will be more of a rodent-borne diseases. Then after 4 weeks, that comes time of Anopheles and Aedes. So there will be a lot of due to stagnation of water, there will be a lot of dengue, malaria, chikungunya kind of disease will occur. So these are the spectrum basically. I'm not going everything in a detail due to lack of time.
But what Himna is mentioning is any possible through water contamination or due to mosquito bornes or other zoonosis, sometimes it is reported that even hantavirus and then hantapulmonary syndrome, hemorrhagic fever have also been reported in the cyclone period. So it is very, very important during that scenario. So what are the various diseases that can occur so that our differential diagnosis while evaluating patients will become very easy. Himmat Singh Rathore bhai, okay, I know you have some anger on me because I have not asked since long time. Yes, I'm coming to you. So it is not uncommon to come across various injuries during cyclone time. So what is your experience or what do you want to communicate to us, that what are the various kinds of injuries that one can come across and how to manage them?
So according to me, sir, there are three types of major injuries. First one is the physical trauma. Second one is the mental trauma. Dr. Athul already discussed about the mental trauma. And third one is the economical trauma. People who spent his whole life saving and made a home and the home is collapsing. So it's very, we can't even imagine about the economic traumas. So in this topic, I will discuss about what are the physical traumas we can experience during the cyclone or flood. So major trauma usually come by the flying debris, collapsing buildings, then falling trees, fall from height, then motor vehicle accidents. These are the common injuries we usually encounters. And later on, after the cyclone, during the flood, usually flood drowning is the most common cause of the mortality. As the Ravidoshi sir told that there are 500 villagers and 700 become 700. Most of came again swimming. But this is actually we should not underestimate the power of water, because we know the physics, the upper stream is very slow but the downstream is very fast, and usually if we don't have knowledge, then most of the people usually drown because of the downstream, because it is very fast stream. So the drowning is most common cause of the mortality during the floods, and it is because of the sudden gush of the water. And electrical injuries very much common. Then the hypothermia because of the prolonged submersion. Then the water contamination and chemical contamination already discussed in the previous speakers. And the animal bite, because we are searching the shelter. The animal snakes, they are also searching the shelters. So if एक man में दो तलवार नहीं रह सकती है, तो either snake will be there and or the people will be there. So these are the common injuries. So how to prevent this? First, I already discussed earlier. Stay inside. Stay inside. Don't be a hero outside. And then we can mark the some fragile buildings or some fragile trees which may be prone to fall, or we can trim the fragile trees if they are nearby to the house. And the government can mark the fragile buildings even if they are in the very high or very old buildings. Then we can demolish before the cyclones. And we should avoid the works at the height, because some people work at the height, so we should avoid that one. And already we have alarming signs and proper knowledge that cyclone is coming to hit in 2 days. So always prepare for that already, and keep the first aid ready, because already previous speaker told that after the 2 to 3 days there is rush of the casualties, and most of them were either the ecological or the minor injuries. So we should prepare for the minor injuries at home, and don't create the panic situation or the havoc at the hospitals. Always stay calm because we all are sufferers and we always help to help others. If we have suffered less, someone may suffer more. So we have to help them earlier. And nutshell, don't underestimate the power of water or wine.
Oh, beautifully summarized, Himmat Bhai. So never underestimate the power of water. We have seen a lot of the social media videos as well. Many people with the underestimation, they want to cross the even smaller water passages by driving. Okay, they will be carried away in the floods. So please do not do that. And it is very, very important to understand that resources availability during this time is very, very limited, and we have to use the resources very appropriately. And Athul, what are the? I heard that while I was reviewing the literature, there are various chronic health effects like respiratory. There are some amount of malignancies that can occur post cyclone affected areas, and spontaneous abortions can occur. What is your comments on this?
Yes, sir. Even I have, when I went through, there were studies which particularly concentrated on the obstetric complications as well as malignancies and respiratory conditions which occur. So malignancies, I think the main point here to be noted is whenever there is a cyclone or a flood that is happening, there might be leakage of chemicals which occur. There can be lead, there can be carbide, or there can be other gases or poisonous gases which can occur. So if you have a genetic predisposition to malignancy, this can in turn activate your genetic changes or mutations, or checkpoint inhibitions may be lost, and this in turn can cause malignancies. As we all know, even something which is totally unrelated, but even after the Bhopal gas tragedy, because of the gas leak, even till now there are hardships which have been followed by the people. Secondly, there are studies when you come to maternal mortality and such things, or obstetric complications. There have been studies that have shown that in flood affected regions, pregnant women who were affected during floods, their deliveries, there are high chances of miscarriages. There has been high chances of kids being born with a low birth weight or IUGR, etc. So a lot of this may be due to the mental trauma or the psychological aspect of flood that has happened, or because of the rapid movement or shifting which occurs during flood and cyclone, and due to the rehabilitation processes and all that. And thirdly, there might be nutritional deficiencies which can occur in the pregnant women because of the lack of availability of resources, the lack of care. Maybe there might be lack of vaccination, iron tablets, calcium tablets. Because in a flood situation, you are in an emergency, you might not be able to take care of a pregnant female in the same way that you would have done if there were no flood. So there might be definitely nutritional deficiencies, and even identification of disorders may have been delayed. Their vaccinations might have been delayed. Their medical checkups might have been delayed. So all these factors in turn will affect the maternal mortality as well. And respiratory illnesses, as we all know, whenever you get a viral infection, whenever you get a pneumonia, or whenever there are acute severe respiratory symptoms which occur, there can be long-lasting complications which can occur to the patients. There can be lung fibrosis. There can be a residual obstructive airway diseases which can occur. Or even if it's a severe infection, it can affect your heart as well. You can have a pulmonary hypertension. So in this way, it's a mix and match of all factors coming together and creating a problem or a disease as such, and especially related to malignancy, because you get exposed to a whole array of chemicals which we are not exposed in normal world. Because of the cyclone, if a factory gets damaged, there might be leakage of poisonous gases which occur.
Absolutely. Brilliant summary, Athul. And I must ask now, Debajyoti Bhai, that there are reports of the fungal infections flare up, particularly aspergillus. What is your comments on this?
Yes, sir, Dr. Vijay, sir. That's a very important question and interesting question. Actually, after flood, during flood or cyclone, what happens is there's vegetation. Subsequently, after the flood, there is vegetations going in the surrounding areas. That is one. And secondly, lot many houses and all will be broken, and there will be water leakage. So because of this seepage, there could be a lot of fungal elements, and that can infect the human beings. And then secondly, from the agricultural pests surrounding the flooded areas, there could be the fungal diseases again coming to the human being as well as to the cattle and other things. And among these fungal ailments, there is aspergillus also. So the incidence of these fungal diseases and aspergillus infection has been found to be high in the period after floods, in the immediate future or subsequently. Thank you, sir.
Thank you, sir. And last quick comments from Athul ji for what are your inputs on how to mitigate this psychological trauma. I'm also coming back again, and I know I have asked this question in a different format, but the literature review also says that there are reported suicides as well. So how to, what makes them to commit suicide, and then what are the various factors that we need to do to mitigate this?
Okay, sir. Yeah, there have been, as you told, sir, there have been studies which showed there is an increased evidence of suicides post-flood scenario or a post-cyclone scenario. The most common thing here is, as we all know, it's a big economic burden. As Himmat sir rightly mentioned, there is a big economic burden that is occurring because all your life savings or all your savings are gone. Many of the people lose their jobs. So in such situation, even we have seen during COVID times, there has been an increase in suicidal rates because many a time sometimes it's not just that the economic burden, sometimes you lose your loved ones as well. And it's totally unpredictable. If it's due to a chronic illness or something, it's something which you are always prepared for. This is something that happens just like that. In front of your eye, your entire livelihood, your entire savings, or even a close one is gone. So one important point to note here is, along with, as everyone told you, you should take vaccination, you should take medications, there should be essential medicines which should be ready. I think a psychologist also plays a very important role here. As we all know, even during COVID recovery times, we always used to keep a psychological evaluation as well as a psychological counseling which is necessary. So a psychological counseling of the patient is very, very important. I feel the evaluation should be done. You should be and as we all know, each one help one. So we should, as a community, take care of each other, because it's a loss is something which cannot be explained by someone, and sometimes it might be an irreparable loss. So we should always keep a watch on people and counsel them properly. And especially if the patient has history of any psychiatric illness, we should always make sure that they get a proper treatment by a certified psychiatrist. So these are the various ways in which we can possibly try mitigating the psychological problems which might occur. The rest of the steps have to be done at a very, very higher level. I feel all the economic economic mobilization or the relief measures or the relief fund or relief amount is something which cannot be done at a higher level. I feel it's something which has to come from a higher level. But what we can do is make at least for symptomatic people, do a psychological evaluation, make sure they get an appropriate treatment at the right time, and try to help others in such a scenario.
I can see a wonderful empathetic doctor in you while you are commenting this question. Please keep it up, because knowledge anyone can acquire, skills anyone can acquire, but empathy is I believe it is a God-given gift. I have seen a wonderful empathetic voice here. Please keep it up, Athul. And all nice things, great things at one point of time will come to an end. But before closing, I would like to take brief one-liner or two-liner summary from each one of you, and of which I'll conclude. So can I go to Dr. Him? Your conclusion remarks?
Yes. Sir, I think such kind of talks, such kind of webinars, such kind of training should be done more at a grassroots level also, at village level, at your nearby district level, at your nearby PHC, CHC level, just free of cost. You can go we go lots of CME. You can even plan one day for your community, go there to village level, taluka level, district level, and just give such lectures. That will strengthen this preparedness. And second thing, just last thing, I think this webinar itself is a preparedness part done by CCI at a national level. So it is a small contribution.
Thank you. And Himmat bhai? Unmute, please.
It's my pleasure to be a part of panelist in this wonderful discussion. And I just want to conclude my talk in the few lines that our forecaster can accurately determine the location, the trajectory, the pressure, wind speed, rainfall. So we should always listen the forecasting, the warning, proper evacuation should be done at time, and we should evacuate our high-risk people in the high-risk localities to the as early as possible. And I told one line that never underestimate the power of air and water. So everyone should be aware about this. Thank you.
Absolutely. Right. Athul bhai?
Yes, sir. It was really heartening to see CCI taking up a topic. I haven't seen anyone discussing this in any forum anywhere. So that is a great initiative. Because even when I shared the topic with my friends, and they are like, this is something which they have not seen, right? Asthma, COPD, pneumonias, everything we discuss every time. This is something what you call as a kind of hatke kind of topic. So basically, as you already told, as sir also already told, the most important thing here is to be prepared and to create awareness among people. Even if if there's a cyclone or a flood threat that is there, it's really important to shift the people from there to the rescue camps as early as possible, to limit the amount of the economic the economic disruption or the economic destruction is something which we cannot take care of, but at least human lives can be saved. So that is one thing which is very important. And the disaster preparedness, and just create an awareness among everyone as to what has to be done. So thanks for the opportunity, and it was a really good topic. I mean, it's something which is really different.
Unmute.
Yes, I would like to thank CCI and Vijay sir for inviting me as a panelist as well as a speaker. So I agree with Dr. Himmat's remark, as I am from a subject in which we believe in prevention, as the saying, prevention is better than cure. So the well prepared we are, the well mitigation of the risk factors have been done, the less response and the less recovery will be required, so that the society and the community can come back to the normal terms as quickly as it never happened. Okay. Thank you.
Bhattacharyya ji.
Thank you, sir, and thanks CCI for giving me the opportunity to come into this talk as a panelist, and it's a very interesting topic. Now, coming to the one-liner, what you said, so I'd like to highlight what my previous speakers have said. That is what we should do before and what we should do after either the cyclone or the floods. Like as you said, sir, Dr. Murli sir, that in France, after a severe flood, also the mortality was very low, only 6. So that India is going to be a developed nation, maybe in our lifetime. So if we want to be that kind of a nation, so we should work in such a way that we disseminate the information about the possible when the cyclone or the flood is going to affect the areas, and prepare them for how to deal with it beforehand. And secondly, after the cyclone or the flood has affected the area, we should help the people there by NGOs, by the state as well as the central government to build up their houses, get their jobs, and look after their medical illnesses. That's very important. Thank you again, sir.
Thank you, Debajyoti sir. And it is my turn to give the concluding remarks. There's a wonderful spectrum of NGOs that are working relentlessly during these disaster times. Let me name few of them: Seva Bharati, Rapid Response, Goons, HHIT, Habitat for Humanity in Indian Trades, and United Way India. These are the various things. They are working selfless. And of course, we doctor, we're always there for doing selfless work. So my points here are very, very pertinent. And there is an impact of global warming that is happening across the and it is impacting every nation. So on that note, it is our duty to pledge today and every day that we contribute for not to damage the climate, not to and decrease as much as global warming by our individual small contributions. That may be today you may reach your hospital on cycle, instead of coming on a car, or you can carpool, or you can come in a public transport like metro or bus to decrease the pollution. That may be the small contribution from you, but collectively it can affect the next generation by giving a better climate. And because because of the impact of global warming, there is extreme changes in weather is happening, and thereby we are bound to, unless we contain this, we control this, we are bound to watch so many disasters in the upcoming future. So for which preparedness is very, very important. We have discussed throughout the webinar. But what if only preparedness? It is not the preparedness alone. Preparedness in action plus action is very important to deliver the best of the best care to the needy ones. And nowadays, we are fortunate enough that the remote sensing satellite facilities, that India is one of the global power in terms of satellites. So it is giving the well in advance of the alerting system, warning system, so that we collectively fight during these times, and to bring the awareness as quick as possible, be prepared and be in action whenever it is necessary, so that the entire damage can be made much lesser. This is what I want to say. And before closing, I must thank you, each one of my esteemed panelists, Dr. Bhattacharyya ji, Dr. Kartikey, Dr. Him, Dr. Athul, and Dr. Himmat. Brilliant contribution. Without your contribution, today CCI would have not made such a wonderful webinar for our audience. And the backbones of CCI, always the Mr. Amit, Mr. Vinod, Vipul, and Vijay. They work relentlessly for this webinars. Thank you, one and all. And our core committee, our President Ashish Dubey, Secretary, National Secretary Anil Maske, and Narayan Pradeepa, Atribai, and the core members, Dr. Kirat, Shivani, and Nitin Bhai, Raja Bhai. Without your contribution, we would have not done this webinar today. And without wasting much time, and then I would also give a teaser, the next webinar next Thursday, and the CCI is also planning a webinar on current COVID-19 JN1 variant, which may be telecasted well in advance of next Thursday. And I urge all the audience on delegates to participate as enthusiastic as ever, and wonderful talking to you. Good night. Bye-bye.